Welcome to the Mountain Morning Show. It's a good morning here because I have Beth Armstrong from the People's Health Clinic. How are you doing this morning?
So good, thank you. Just a little tired, but good.
A little tired. It's a little early. Plus, you've been traveling.
I have been traveling. Got in late last night.
Do you have some jet lag?
No, it's just DC, so it's actually in, it's in my favor going there and a little less coming home.
Yeah, that's true. So tell me about your trip.
In addition to being on the board of the American Hospital Association, as you know, I'm the executive director of People's Health Clinic, and the AHA, the American Hospital Association, is an association that brings together individuals from local areas. We're in a district called the Western District, and there are 5,000 member hospitals, but there are only about 30 of us in the room. So we represent an awful big sector of hospitals in the country. So who else
are you representing when you go besides the People's Health Clinic?
Oh, no. So I represent the region, so I represent 6 states. So the Western region.
Which states? That's what I was trying to get at.
Right. So I'm on the board also of Park City Hospital. And the reasons there's just feels, I'm sure, there are a lot of hospital entanglements there, but the reason is for about 25 years I ran hospitals. I was the CFO and director of several institutions in Louisiana and in Los Angeles. And then whenever I moved here, the hospital was just getting under construction and underway. So I went on to do something else for a while, and now I've come back sort of into the medical field through via the People's Health Clinic. Awesome. So I represent, they were testing me early in the morning, Idaho, Utah, California. So it's just sort of that western region from Colorado over.
Very cool. So what was the trip about? Why'd you go?
We go yearly to DC. We do lobbying, so we make appointments with our representatives in Congress. Actually, House of Representatives was not in session this time around. They were off this week. They'll be in joint session next week. So there were only senators available. Okay. So I did go meet in with Senator Hatch's office. I went to a Medicaid briefing. We have meetings all day for 2 days off the Hill regarding different things that the AHA is. It's an organization that pushes for the betterment of hospitals and their patients. So then we only spend one afternoon actually on the Hill. So I got to, I was actually I was trying to meet with Senator Flake, and actually got a meeting with him. Well,
what was that meeting about?
Everything is about, the biggest issue today is the Cassidy bill. Okay. Tell me a little bit more about that. Okay. I know it's all, and by the way, it's all very confusing, and you have to be a scholar to understand what's going on.
No big deal.
Even when I'm sitting in the meetings, you have to. I take copious notes, and you have to be attuned to what the end game is. So you know that the ACA repeal, the initial one, failed. They never brought it to a vote because they knew they wouldn't have enough. So now, at the last minute, last ditch effort, for a lot of reasons, they're trying to push through the Cassidy bill, which actually, in effect, is more harmful than the original repeal and replace.
And why is that?
There is going to be, it's all funding. We haven't even started the Medicaid expansion subsidies. That was not supposed to start until 2020, so they're going to do away with that. Okay. In 2018, if this bill goes through, there will be swaths of individuals that won't have any coverage at all. Wow. The original repeal and replace was 22 million. This is looking more like 33 million. The problem with Cassidy is they're trying to push it through so quickly that it hasn't even had a chance to go through the budget office. So the CBO hasn't had a chance to tell us, oh wait, stop, this is really awful. So
why do you think they're trying to just push it through without even passing these steps?
On September 30th is more or less the drop dead date for for a lot of reasons, and they're all congressional reasons why this has to be done by the 30th. Got it. The big things that we need to be, well, as you know, in Utah, we didn't do the Medicaid expansion, and we were actually hoping to, if ACA stays in place, we're going to try and get the Medicaid expansion in Utah. And we think it's important, and we really want that to happen. If Graham Cassidy goes through, we won't even have to make that effort, because that will go away. For. Yeah. That, and just for, I actually did not get to meet with Senator Hatch. He was otherwise busy. I've been doing this. This was my third trip with the lobbying with ACA, or trying to get meetings with him through the ACA. And for 3 years, he's been busy. So
that's convenient.
I just honestly, I'm starting to feel bad about it. I just think he doesn't want to see me.
I don't know who would want to see you, Beth. You're too cute. And you bring gifts when you come.
I did. I brought healthy snacks.
Yeah, she bought a clementine for our producer.
I always have to suck up to her.
Right. So what else do you want to cover?
So now we're back to work. Today's first day back. I was actually only gone Monday and Tuesday. So it's a quick trip in and out. We get a lot of meetings in, and really you get back and then you have to sort of digest everything that you've heard.
Yeah, which is probably a lot.
It is a lot. My biggest concern with Graham Cassidy is probably the block grants, which instead of funding the states and funding, what percentage of Americans do you think are affected by the ACA?
I have no idea. No idea. I couldn't even begin to imagine.
So
and give you a number.
I know they're talking about it, and you think that it's these horrifically big numbers, and honestly, it's 10%.
Okay.
That will be affected, but that 10% represents about 23 to 30 million people.
Yeah.
So there's a lot of lives involved, and what one of the plans of Graham Cassidy is to give the states block grants, which sounds good. They're going to give the states the money, and then the states can decide how to spend it. Unfortunately, they can spend it on health-related things. So
what does that even mean?
Exactly.
How generalized can that get?
That's exactly right. So that's one of the biggest concerns, is where the funding will end up going. Right. And once it gets lost in the bureaucracy at local levels, who knows? It's better to have it say we'll have this, this, and this. So honestly, 7% of the people that were receiving insurance through the ACA, 7% of those people found that their rates went up. What you did see were your health insurance, people who were covered privately, their insurances were going up because sicker people were coming into the marketplace. That's all going to level out, because hopefully by being insured, people will start to get healthier, which is what we're all about at People's Health Clinic. We want you to, we want to see people, we want them to have a health home. We want to make People's Health Clinic their yearly annual visits, so that we can examine, draw blood, test, see if there's anything they need to be concerned about, make sure they're not pre-diabetic or hypertension or hypertensive, or that there's anything going on chronically that we need to start taking care of now before it becomes much worse.
Yes. So let's talk about People's Health Clinic a little bit. What services do you guys provide? Pretty much most everything besides emergency, is that right?
You're so good. I like that. Yes, you can come and work for us, because that's all you need to know is that. So we are a volunteer-driven, based right here in Park City. We provide health coverage for the uninsured of both Summit and Wasatch County, and our job is to just make sure that people without insurance have a place where they can go whenever they're not feeling well, so that they don't have to wait till they're so sick that they end up in the emergency room. Right. So we take care of anyone from a year old. So if a child doesn't have insurance under the age of 1, they're covered by emergency Medicaid. So we don't really deal with infants. So it's the a little bit older children on up. So anybody that's just over that year old up to whatever age, 60, 70, 80, whatever. 90? 90, we don't care. Right? Older the better, bring them in.
So are you guys doing a lot of preventative care as well?
We do a ton of preventative. Like I said, we test whenever a prenatal mother comes in. Of course, she is given all of the testing, making sure that she's healthy, so that her outcome for her baby is better. We do postnatal counseling, counseling on birth control methods. At the clinic, we believe that you should wait at least 18 months between pregnancies. 2 years is the optimum spacing between pregnancies, not between births.
Why is that?
Your body, the mother's body needs to recover. It has to have time to recover. A lot of factors, like the amount of time that you have to spend nurturing a newborn and a young infant.
Possibly breastfeeding as well.
Absolutely.
Yeah.
Yep.
Well, it sounds like you guys offer a lot of services for those who need it.
Yes.
Which is exactly what you're doing. And I appreciate all your efforts going to D.C. every single year, trying to meet with Senator Hatch. Senator Hatch, she wants to meet you.
I do. I understand. Why don't you like me?
Beth Armstrong, thanks so much. I really do appreciate your efforts. I feel good that you're looking out for us.
Thanks. My
pleasure. All right, we will be back with a lot more after this.